Hello, my name is Taisha Watson, and I'm recording a video on nursing delegation. Delegation is a complex decision-making strategy that we registered nurses do to accomplish our goals in a safe, efficient manner. It leads to high-quality care for our patients. It involves a delegator, someone who is given out a task, and the delegatee, who takes on the task. The delegatee must be competent and verbally accept the task. And the delegator must know that the person they are giving the task to has the skills to complete said task. Who can delegate? RNs to other RNs, LPNs and CNAs, and LPNs to CNAs. CNAs are considered unlicensed nursing personnel. An example of this is in the state of North Carolina, an RN can delegate the task of Foley placement to an LPN, but an LPN cannot delegate the task of placing a Foley catheter to a CNA1. Now, in the state of North Carolina, a CNA2 is within their scope of practice for Foley placement. So if they have the competencies documented that they have been trained in placing a Foley, you can delegate Foley placement to a CNA2. The national guidelines for nursing delegation. The process starts at an administrative level. The nurse leader must confer with other nurse leaders on what procedures can be delegated and what competencies need to be performed to show that the delegatee can perform these tasks. But they do this by reviewing policies and procedures. The nurse leader or the organization also must provide training and education for these tasks and provide documentation of competency. Communication is a two-way street, and it must be clear and reliable. The delegatee must be able to report if there's a change in a patient's condition or the circumstances that might lead to the task not being completed back to the delegator. The delegator must always have accountability for the task because it was originally assigned to them. Open communication between the delegatee and the delegator ensures continuity of patient care. The 5 rights of delegation. First is the task. Is the task appropriate to be delegated to the person you're delegating to? As I used in my example, a CNA2 can be given the task of Foley placement for a patient. Circumstances, equipment, resources, staff and ratios, situations. Does the CNA2 know where all the supplies and equipment are to place a Foley catheter? Do they have the competency to place the Foley catheter? The person, is the person willing and able? Do they have the expertise? So even though it's within the scope of practice for a CNA2 to place a Foley catheter, if you try to delegate to a person who is a CNA2 and they say, oh, I have not been trained on placing a Foley catheter, I do not have that competency, and you see that it's not documented, then that still is not the right person to delegate that task to. Direction is, are you giving clear and concise instructions? If the delegatee is expressing understanding verbally that they understand where the supplies are, yes, they've done a Foley catheter placement before, yes, they feel comfortable doing it. And supervision, did the delegator check and see that the task was performed properly? Did they monitor the delegatee to make sure that it went smoothly? Did the delegatee provide feedback after the task was completed and also submit documentation that they completed the task? The North Carolina Board of Nursing has a mission to protect the public by regulating the practice of nursing for RNs, LPNs, and advanced practice nurses. The Nursing Practice Act is what gives authority to the North Carolina Board of Nursing to regulate nursing practice. This helps protect the welfare and safety of the public. They also define the legal parameters for nursing practice and the criteria for delegation. The National Council of State Board of Nursing also can give you information on the proper way to delegate. They start here with the employer, the nurse leader, and their responsibilities. The licensed nurse, who is the delegator, and the delegatee and the responsibilities for the delegatee. And shows that proper two-way communication, training and education, and communicating information about the delegation process helps ensure public protection and safety. So with proper delegation, everyone knowing the policy and procedures of delegation and having the proper training and competencies for tasks within their scope of practice allows for everyone to work together. This ensures patient safety, being reflective of the delegation process and always reevaluating how we delegate tasks to our teammates allows us to improve our delegation practice. So we have to always learn to be reflective and work together, and also be flexible with our teammates and be understanding, providing a positive environment when it comes to delegating tasks. And in that way, we all ensure continuity of patient care and giving the best patient care that we can. Happy delegating.